Yes, yes, yes. A very good evening to you, Saturday night, and I'm sure, Charlie, if you're not doing anything by this time, call a friend and tell a friend because Charlie, it's education time. My name is Lord Caliber, and I welcome you to our program, our health program. Let's talk health, and gladly today, Charlie, with all the drugs and foods, and it's all was really helpful. I'm glad to be with you tonight again to bring to you another exciting, dicey, complicated topic that we all need to learn about. Stroke. So if you're with me and you can hear me, I say welcome back. We move straight to our honorable guest to introduce herself. Madam, welcome to the show tonight.
Thank you, thank you, thank you.
And you're looking so beautiful.
You look good as well.
Yeah, 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 yeah. So we're talking about the almighty stroke tonight. Stroke. Charlie, stroke is really causing the able to be disabled. Stroke is uh, breaking families, breaking homes, causing problems, taking careers out of people, shutting lives down. Stroke. What is stroke, Madam Ella? First of all, you do your whole introduction and you zone out into the conversation, please.
So I'm Ella Nortey. Everybody calls me Ella. I'm a physiotherapist by profession,
Right?
and I work in Takrady at
Beautiful.
the Adventist Hospital. So stroke. Hmm. I'm going to try and make it as full as possible.
Right.
Basically, stroke is a condition that comes about when blood supply to the brain is limited.
Okay.
So if blood supply going to the brain cells will die off, and then the function that they control is lost, or let me say, temporarily, maybe permanently lost. Is that okay?
Okay.
Yeah, yeah,
He said when blood supply to the brain is temporarily lost, uh, one can be temporarily or permanently lose coordination or bodily functions, right?
exactly.
Right,
Ex-
right. Okay. So before you continue, more than 2,400 years ago, the father of medicine, Hippocrates, recognized and described stroke have had very little power over this disease. But the world of stroke medicine is changing and new and better therapies are being developed every day. Today, some people who have a stroke can walk away from their task with no or few disabilities if they are treated promptly. If they are treated promptly. So then we begin from the risk factors. What causes stroke? As we explained it, but if you would delve a little deeper.
okay, so like I like the way you put it, risk factors. You would like to use the phrase risk factors as compared
Okay,
to stroke. Okay, so for the
okay.
risk factors, a major risk factor is hypertension. High blood pressure
Oh,
is a major risk factor. We call it BPB, but actually
yes.
high pressure, not just having, everybody has a blood pressure, but the high blood pressure puts you at a very high risk of developing a stroke. We've got diabetes, another risk factor. We've got smoking.
Wow.
In fact, they say smoking increases
Oh,
your chances, yes, of getting a stroke. Um,
so
there's okay,
yeah.
so we have like usually
I
the
really,
risk.
you mentioned smoke. So I wanted to know if smoking fish or smoking tobacco or smoking weed or smoking what?
General, tobacco, you're smoking nicotine, you're smoking marijuana, whatever it is, whatever it is you're smoking, there's still some toxins going into your lungs. Yeah, that's
Okay.
what actually causes the damage. Not exactly what it is you are smoking, but the act of smoking.
Okay. Okay.
Yeah.
All right. So go ahead.
Okay, so I'm
So
reading
you,
my
yeah, you made mention of hypertension. You made mention of diabetes. You've made mention of smoking. As I asked you what type of smoking, you said all the toxins that are associated with smoking. Funny enough, one day I gave a friend fuel with smoking paper, and he couldn't consume it. he asked me what, and I was trying to get him to understand actually he should really slow down on the smoking, and he said, oh, the smoking paper was made out of rice, and I'm like, okay, then here is some stew and fish. Can you really eat your smoking paper with the rice? And he couldn't. So over to you. Just get some.
hello.
Yeah. So
Mm,
yeah,
that's an
smoking is bad. That's actually different.
yes. So
Okay.
we have the factors that you can modify, and then the factors that are
Okay.
non-modifiable. So something like hypertension, you can do something about your pressure that would prevent you from
Okay.
developing a pressure. We've got something like diabetes. You can make sure you control your diet, take your medication regularly. Smoking,
Okay.
you could obesity, obesity
Hmm.
in a how setting when somebody is gaining weight and all of that, we all hey, life is good, you're making money,
Why
but it's actually
final?
a sickness. Obesity,
Oh.
major thing, because it comes with high cholesterol level. So if your
Okay.
cholesterol level is high, you are increasing your risk of developing a stroke. So all these things are things you can change. Lack of physical activity, you don't do any exercise at all, your heart is in a poor condition, you are preparing yourself to maybe develop a stroke in the future. Um, alcohol,
Okay.
alcohol. So usually
Wow.
more than 2 drinks a day. So if you are somebody who like you don't even drink the whole week, and then let's say Friday, Saturday, you drink about 2 poly tanks full of alcohol, you,
It's not cool.
you're not you're not doing good for yourself. Okay,
Wow.
so this that you can change, but there are other risk factors that you can't do anything about, whether you like it or not. It puts you at risk. So one,
Hmm.
the older you get, the more likely you are to develop a stroke.
So
Of
age
all things,
is a
yes. So usually they put it
wow.
at
Okay.
55. Um, after you cross the age of 55, every other 10 years you have, your chances just keep increasing and increasing because your blood
Wow.
vessels, everything strong and flexible as they were while you were young. So
Right.
it's just nature. So at first, we used to see a lot of stroke cases, people in their 70s, 80s, and all of that. But currently, people as young as 30, 35, 40, they are getting it.
Hmm.
Yeah,
So
they are getting
before we
out.
really zone into why the youth are becoming, victims of this disease, let's check in. What are the types of stroke? Are there types, and what are the types though?
Yeah, there are types. There are types of stroke. We have two major types. Then we have like
Okay.
lesser ones, which are not really grouped as types. So we've got the hemorrhagic.
Get my water too. Yeah. So as she's really getting herself some water to drink. Uh, let's keep ourselves. Did you say in ancient times, stroke was called apoplexy, general term that physicians apply to anyone suddenly struck down with paralysis, because many conditions can lead to sudden paralysis. The term apoplexy did not indicate a specific diagnosis or cause. Physicians knew very little about the cause of stroke, and the only established therapy was to feed and care for the patient until the attack ran its course. The first person to investigate the pathological signs of apoplexy was Johann Jacob Wapfer. Born in Switzerland in 1620, Wapfer studied medicine and was the first to identify postmortem signs of bleeding in the brains of patients who died of apoplexy. From autopsy studies, he gained knowledge of the carotid and vertebral arteries that supply the brain with blood. He also was the first person to suggest that apoplexy, in addition to being caused by bleeding in the brain, could be caused by blockage of one of the main arteries supplying to the brain. That stroke became known as cerebrovascular disease. Cerebral refers to the part of the brain. Vascular refers to the blood vessels and the arteries. So as we wait for Madame to reflect the truth, as I with the yes. So yes. So as you were up, I'm sure you did hear the note I was reading. We just talked about Johann Jacob Waffer and how he had his discoveries about stroke and all that. So we're about the type of stroke, and you made mention of hemorrhagic,
Yes.
and I think it's clinical. So yeah, you said there were two main types. So over to you.
Okay. So two main categories, but there are still different
Right.
subgroups. These. So the first one I'd like to mention is the hemorrhagic stroke, which is the
Okay.
most notorious one. So the hemorrhagic
Notorious,
stroke,
you said.
yes, is the more notorious one.
All right.
Yes. And usually I've noticed this the pattern of the hemorrhagic strokes, they come with more loss of function. The recovery is not as smooth and easy, and it's usually
Okay.
okay. So with the hemorrhagic stroke, what happens is that the blood vessel, the vessel in which the blood is flowing through,
Yeah.
ruptures. So it will just burst, and then there'll be spillage in the brain, whichever region it is. Depends on which blood vessel is ruptured.
Right.
So that one happens. It can happen maybe um the the space in the blood vessel becomes a bit too narrow, and then the blood pressure is high and high and high. Then before you realize, pop, the blood vessel rupture.
Right.
And then the
Okay.
spillage.
So that's what the hemorrhagic stroke.
That's a hemorrhagic stroke.
Okay.
And the other one is the ischemic stroke. Is an ischemic stroke. So the ischemic strokes, usually it has to do with uh, a clot, like there's a blockage in blood flow. So usually there's a blood clot, and then it prevents blood from flowing and then supplying oxygen to the parts of the brain that vessel is responsible for.
Okay. Okay.
We've got so there's this other one too. Sometimes even these two can happen together. You can have
Really?
yes, you can have one single person at the same time experiencing a hemorrhagic stroke together with an ischemic stroke, and you can
Wow. That would be
imagine,
bad.
yes, a recipe for, I don't even know,
Game over.
for disaster. And then the TI, the TIA, sometimes they refer to them as the mini stroke, because with this one, it's very temporary, and then the symptoms may last less than an hour, few minutes, and in 24 hours, you may be back. So these ones, they are like warning signs. If you have a TIA,
Oh.
you know that there's something you are not doing right. There's something that has to be checked.
Okay.
No, that's full blown stroke. Uh, and then there are some other ones. Those ones are not really. We have the
Right.
yes.
Okay. So
So I think that these three.
hemorrhagic, ischemic, then we have the transient one, the CI that you
Yeah,
made
or the mini stroke.
mention of the CI. All right. So now, Ella, let's bring it to our home, experiencing it. Right.
Okay.
What would one identify with somebody? Like if you are with somebody and the person is developing stroke or zoning into that area, what are the signs and symptoms that one would show? What are the indicators?
Okay, so there's an acronym, or let me say FAST, fast. Anybody who
Fast,
you should know this. FAST. So F,
FAST.
yeah, talking to the person, and you see that a part of his face just shuts off, like one eye is closed, that side of the mouth doesn't seem to be
Okay,
moving. First thing, there's a face droop one side, and if the person tries to smile, it's like a one-sided, a lopsided smile. It's the
okay,
first. There's sudden weakness in their arm. Sudden weakness in their arm.
okay,
They can't usually it's one side. They can't lift both arms. One is just, and then the third S. So face droop, arm weakness, and then the S. The S stands for speech difficulty. Speech difficulty.
okay.
So they are talking before you realize the speech is slurred, or they are mispronounced.
They are flaring light.
You find the word to even say. And T, time to call 911. But Ghana, I can't say time to call. Time to stop a taxi. Time to
The
stop a
traffic
taxi and go to
alone,
the.
Charlie.
Hmm.
Okay. So
So
we have
that's
the
it.
fast as you just indicated. If I'm to recap, you said the F is for face. So if you're with somebody and you see the person having drooping face, that's for the F exactly. The A you said is for the arm weakness. The S is for the slurring speech when you're with somebody and the person is talking and they cannot really mention words well, talk well. Then you should look out for this sign that it might be a warning or a danger sign that the person might be having stroke. And the C you said is for the time. But here in GH, it's about the taxi and the traffic and the trotro hustling to get to the nearest healthcare center. So, but then that is very dangerous and that is very sad on our part, right? So
Yeah.
when you are with such a person and the person is going through all these indicators and the time, what can you do? Is there any first aid mechanism is there anything that one can do?
Whew. First,
Hmm.
the first aid for someone experiencing a stroke is to get them to the hospital as soon as possible. As soon as possible. Even with a hemorrhagic stroke, if you are able to get to the hospital within 4 hours, understand there's a drug that can even reverse the damage. But if even that 4 hours is a challenge. Usually somebody will be experiencing the stroke, they'll say on Dow Chanopa, now you're hospital. Or by the time they
Hmm.
get to the hospital is 2 hours, they are going to be in a queue for a CT scan. The diagnosis is going to delay. So you can't really have, I can't say for a fact that maybe give the person this CPR, this or that, it will reverse the, no. We have to go to the hospital. Um, they'll usually control the pressure. When the pressure goes up, get a CT scan, and then they'll see how the management goes from there.
Okay. So thank you very much. nti yen nuanom na ɔmo tie na yɛde pɔtɔ kasa ɛhyɛ mo so no na ɛbɔ no sɛ panam nso moanya ntiaseɛ wɔ deɛ a yɛka no ase yɛka ndzedzoe yareɛ ho asɛm stroke na deɛ yɛn nua baa a ɔyɛ physiotherapist ɔkyerɛ me ate aseɛ no sɛ nneɛma bi wɔ hɔ a ɛboa ma saa ndzedzoe yareɛ no ɛba yɛn akwan mu one ɛyɛ biribi a yɛn nyinaa yɛnim a yɛfrɛ no bp high blood pressure ɛne esitire yare diabetes obi nso a osmoki ɔnom drugs ɔnom rasafo yɛn ahaban kronkron no ɛna obi a ne cholesterol nso ɛwɔ soro saa nneɛma nyinaa no ɛduru si bea bi a ɛma wonya saa stroke yi na wama yɛ ate ase nso sɛ stroke no yɛwɔ mu afodeɛ mmienu hemorrhagic and ischemic nkyɛkyɛmu no nyinaa sɛ baako no ɛyɛ sɛ wuntini na mogya ɛɛhyɛ mu no ɛɛpae na mogya enwum egu w'adwene mu deɛ edi akyire no nso no ischemic no nso so ne sɛ biribi esi mogya kwan no ho kwan na ɛma mogya ntumi nkɔ w'adwene mu na enya ne aduane a ohia na ɔde ayɛ adwuma ɛno nso tumi ma wonya stroke na ɔka nso sɛ yɛwɔ baako nso a yɛfrɛ no tia ɛno no ayɛ sɛ ɛyɛ warning sign na within 24 hours no ɛno koraa no etumi kɔ a ɛngyaw ɔhaw biara ba ne nyinaa akyi no hemorrhagic ɛne ischemic no ɔmo na sɛ wonya a ɔmo tumi egyaw nsunsanso bɔne na ɛsan so ebi saa ne sɛ sɛ wɔne obi tena hɔ na sɛ wonya nsunsanso anaasɛ dɛn na ɛbɛda bi akyerɛ ne sɛ akyerɛ wo sɛ wonya stroke a ɔkyerɛ yɛn sɛ yɛwɔ biribi a yɛfrɛ no fast a ɛyɛ fast a ɛyɛ sɛ yɛn nyinaa no yɛbɛ yɛni na yɛde hwɛ ɔsɛ ɛfo no ɛyɛ sɛ wɔne obi tena hɔ na sɛ mpofi mu no a n'anim ɛkyea ɛyɛ indicator mmienu ne nsa baako adwodwo ɛno nso etumi ɛkyerɛ anaasɛ wɔne ne tena hɔ na wɔne ne kasa na mpofi mu ara no na no kasa no ɛnsisi so yie ɛno nso ɛyɛ ɛso no na ɔkaa sɛ deɛ ehia titiriw paa nso ne sɛ ɛne tii no sɛ ntɛmpa mbrɛ time a wɔde nipa a ɔkɔ saa ɛsidie no mu no ebidu ayaresabea na wɔn etumi ama no ayarehwɛ ntɛm no ɛho hia sɛ saa nipa ko no obenya nti ɛho asɛm na yɛka no yɛtoa so na mbere no yɛbɛda ne kasa no nso na obiara nso anya ne ho ntiaseɛ. Yes, so Ella, we've come this far. Now we are at the hospital. What happens from there? Now we bring the patient to the hospital. They see the doctor. What are they going to go through some kind of test, some kind of imaging check? Take us through the process. Your mic is off.
Okay, sorry about that.
Yes, right.
Okay, so with the stroke, the first thing you want to do is the imaging. So you have to, yes, usually that's what we done. You do some blood tests. They'll do definitely you do blood tests. We have to see whether there's an infection, whether your blood sugar is abnormally high, what's your clotting, the rate at which your blood clots, how fast your blood is clotting, and if you have cholesterol, what's going on. But the CT scan or the MRI is what's going to give a clear picture of what's going on, whether it's a bleeding or it's a clot. So that's where we'll be able to determine whether it's a hemorrhagic or it's an ischemic stroke or it's both. Or exactly. And it will be treated or managed as such. Okay, so if it's a the treatments for hemorrhagic strokes and then the treatments for the ischemic strokes, they differ. They differ.
Okay.
So exactly. So if it's, for example, a hemorrhagic stroke, you are going to be your treatment is going to be more focused on preventing more further blood clots, or even trying to dissolve the clot that's maybe preventing the blood flow. And if it's a hemorrhagic stroke, we are going to do like focus more on um uh, stopping your blood from being,
Clotting.
yes, from the bleeding. You're doing something that's going to reduce or stop the bleeding.
Okay.
Okay. In the States, I know in the Western world, the management is more progressed. So they can, do surgery. They do some kind of craniotomy stuff. That's, you know, but in Ghana here, I don't think that's mainstream for stroke.
Hmm.
So yes, so you try and then stabilize. If it's your sugar, you're going to make sure your sugar is, down to a level that's safe for you. If it's your pressure, the pressure has to be down. So they'll monitor you. So you have a stroke. Usually, they have units dedicated for stroke. If you go to Kolebu, there's a stroke unit where they manage only stroke cases. You've got 24-hour. Okay, but it's not every facility that can have something like that. Maybe they can just jump you up with all other medical cases, but usually you need to be monitored until you are stable. Okay,
Okay.
exactly.
Right. So here in Ghana, let's do some myths and all that. Usually people would have stroke and there will be the affiliation of spirituality being a factor, people witches and wizards being the cause of people having stroke and all that. As a physiotherapist, how do you manage that?
Okay. So there's
Yes.
um there's this model. We have a model that we call it the psychosocial aspect of patient management. Psychosocial
Psychosocial aspect of
patient management. And
okay.
or not, how people perceive or think about their condition really affects their recovery.
Wow.
Trust me. If you can have a client and these things is a bit funny, but it's true and it's proven. You can have a
Hmm.
client who thinks 100% this person is an alcoholic, he smokes, I mean, obese, all the risk factors, hypertension,
Rainbow five.
and yet still he believes that it is his neighbor who has
Wow.
gone to buy the stroke for him. I got a stroke now, man. It's true.
Wow.
And before you'd like break it down to the client that you have this, all these things are already putting you at risk. You, as a health professional, you just have to acknowledge your patient's concerns, listen to him, what he has to say, that this and that
Mm-hmm.
and that, then encourage. Okay, then you close that chapter, and then you delve into what you know or what you believe
The
in as,
science.
yes, but it's not a good idea to tell your client, hey, please, we don't, this is not spiritual. No, no, no. There and then he's lost some kind of hope or trust that you may be able to
Connection. Yeah.
help help him in any way. So I don't know much about spiritual matters, and I don't
Yes.
know how it
Yes.
works, how people spiritually buy people stroke and all of that. I don't know how. I know nothing about it, but I know what I've been trained to do. So yeah.
Yes. So surely subsequently on the show we'll be having people from that other side to also help us understand how these things work. Probably they have the fifth eye or the seventh eye,
Exactly.
whereas they
I'm
can
the
see the market. All right. So now, uh, what are some of the manifestations when it comes to hemorrhagic stroke? That when a person has hemorrhagic stroke, what are some of the physical manifestations that could be seen, or the kind of the disabilities that would manifest?
okay. With a hemorrhagic stroke, um, let's say both strokes, you have weakness, maybe in one side, left or right, whatever it is. But with the hemorrhagic stroke, usually they have a challenge with speech.
Speech.
Yes, they've got, usually you see that they'll have a speech challenge. They'll have um hmm, and even with the language challenge, the person may be able to speak but not understand, or use the wrong words, or you might speak to them, they won't understand what you're saying, but they can speak, they can make a good sentence, communicate and all that. But I won't say communicate, but they can talk. The person can talk but can't understand you. You might not understand, and that one makes the recovery so difficult.
Okay.
Yes, so that's one thing
Okay.
that is associated with the hemorrhagic. And with the hemorrhagic, usually the damage is more expensive as compared to the ischemic. That's what I've noticed in my little experience.
Right. And then if we check the ischemic, is there any difference in the manifestations of this disability?
Okay, with the ischemic, I can say the recovery is usually better.
Okay.
The-
Okay.
uh,
All right.
but they
So,
will
yeah.
have, like, you definitely have some weakness. Depends on how much damage you have in the first place.
Okay. So it depends on the weakness you have at that particular place. She's made us understand that hemorrhagic stroke comes usually with more speech impairments, and the problems associated with it are more extensive. Uh, yes. So now, ischemic stroke is also there. Charlie. So usually outside the hospital, is there any other treatment modalities that really work outside physio and the regular hospital medication to the best of your knowledge?
You mean with like herbal medication?
Yes, usually you would realize it's near some kind of
Wisa,
herbal concoction.
I form Wisa, and all of that.
Yes, yes, yeah.
Hmm. Okay.
How do you relate to that?
So I'm going to say what I know. Okay,
Okay,
but I don't know that I don't know much about the herbal treatments,
right, right.
but I have seen some work. I've seen some do some, nice stuff. You can. It's hard to explain because I don't know what exactly herb it is or what was done, but somebody might come with a testimony. Okay, this is by word of mouth, which is, I've not really, seen the whole process. I've not been to
Right.
any of it before, but some colleagues too have even, said so. Some herbal medications, they work wonders, and some too can really mess things up
Mm,
so bad. And then so it's, I don't know, Kalua. I don't have a stance. Okay. I don't have a stance, but it's not my field of expertise. I have not
right.
much about it, but I can't say that herbal medicine is not the way to go. And I can't say herbal medicine is the way to go, because I've heard, and from good sources, that some do very well with herbal and others is bad. I don't know, maybe
So
there's
I think
something
it's more
there.
education. I think you, the physiotherapist, once you have an association, should also from time to time, I think, liaise with the traditional medicine practice so that that kind of bridge of knowledge sharing can be, shared among you two to express such grievances and learn from each other so that at least together we would all go to better the course of stroke treatment here in Ghana. Now, with that bigger side that I made you pause on, the youth, what do you think is really causing that new generational inclusion of the youth into this, bad state of getting stroke? Is it too much sex? Is it yeah, sometimes you say too much sex and hey,
I
once
don't
I
think
listened to this program and they were talking about sex styles and this man said, hey, don't do wheelbarrow because you will end up having so
but
don't carry the lady because
which one is the wheelbarrow?
I think when the lady put the hands down and the guy carries the legs from the back.
Wow.
Yeah, so
Going on.
yeah. Yeah, so that's what they call the wheelbarrow.
Okay,
So
so
does sex play a role as a risk factor in people having stroke? Is it too much sex that might cause it?
too much sex, definitely not. But when it comes to sex, the main problem is the sex enhancing drugs.
Oh,
Is the sex enhancing drugs. I don't know what is going on, but it looks like you men,
yeah, the
are
big one.
taking drugs to enhance your sexual
Yes,
performance.
yes.
Yes, and these drugs, they interact with your blood pressure, the flow of blood, and all of that. So the sex enhancing drugs, especially the ones that are not medically prescribed by maybe a doctor or whatever, the ones that you buy from, these, I know there are some people online, they sell some things, the dosage, you don't know what exactly is safe. Sometimes the guy wants to
Okay.
go marathon, he wants to do, an all-nighter.
10,
And so
10,
they
10
say
hours.
he might take 4 and all of that. So the sex enhancing drugs, and with the sex positions, what I can say is that they say when you are standing, I don't have evidence, but I know this, that
Okay.
when you are standing and pumping, you understand, yeah, all the blood is in your organ. So like you're standing and then you're not really having
Okay.
a overall circulation. But you can,
Circulation, yeah.
yes, you can stand and stroke or
Do your
whatever,
thing, yeah.
but to ejaculate while you're standing, that's a bit much. So I don't,
Oh.
yes, the wheelbarrow is or whatever, but I think you want, Caliber, if you want to do some wheelbarrow, you should feel free to do wheelbarrow, but try not to ejaculate while yeah. So if you
Right.
see climax, maybe you might want to sit back or relax. Yeah, so
Okay.
that's
So now
dancing drug.
aphrodisiac with the youth is a major concern. Now we have
Yes,
the
they combine
shishas, uh,
aphrodisiac
the,
alcohol.
the tramadol, people blaze, they drink some alcohol, they refreshen it with some tobacco before they go in to do their own job. So this you are saying is a major factor that is really breaking the you down with stroke. Any other related cause? Is it food, the diet that we have today?
100%. 100%.
Mm,
100%. The diet is a major thing. It's like now we have more of a, meat oil based diet, as
Right.
compared
Fried food.
to, yes, fried foods, meats, animal fats. You can see somebody who, might be your size, and then his cholesterol levels may be through the roof. And it's very,
Whoa.
yeah.
So the body size, as you are saying, doesn't really uh, show much. The person might
Yeah,
be slim and tiny, but might have way high cholesterol than the body
somebody,
needs.
yes, yes, it happens.
Wow. Wow. So from what I'm really understanding from you, lifestyle is a major factor in all this here.
Major.
If we have to put all the spiritual myths and all that aside, giving respect to it as we put it aside, aphrodisiac, smoking. The shisha, is it would it fall under this smoking category?
It's way more intense than smoking a cigarette.
Are you
Look,
serious?
I'm telling you, shisha. I've never tried it. I don't know what it feels like or what it is, but look at
The
the smoke
research.
out.
Yeah.
It all went
And
in.
when you go to the nightclubs, it's like it's a trend now. They have shisha rooms, shisha this. So people are really going to have a great impact at the end of the tunnel.
And the secondary smokers, you might not smoke, but you're around somebody who is smoking 247. Yeah,
Mm.
definitely to suffer some of the negatives.
Okay, so now let's bring it home small. Can children below 18 also experience stroke, have stroke?
Yeah.
Is it possible?
Yes. So
Wow,
oh, I've even seen somebody as young as 3 have a stroke. But
wow,
with that one, they are the sickle cell carriers. The sickle cell, the kids with sickle cell. Sorry, the kids with sickle cell. Um, they have. I've not seen like a healthy child have a stroke before. Usually, it's the kids with sickle cell, the children with sickle cell. Yeah,
okay,
it's a major risk factor,
okay, okay. So
but
then,
not. Uh,
when they have it, how do you see them? On your level,
it,
you take them to the same physio protocols.
yeah, definitely they'll have to go through some rehab, but it's very like sad or heartbreaking that a child would
Have a little
experience
failure.
now learning to walk and run and grow, and then already they have this big setback, this huge setback, and it's sad.
Without their good processes, I guess.
Mm-hmm.
Okay. So before you continue, let me just do my small advert here. So if you are in Western region, Safari, Ghana, and you need any foreign home goods, qualification work, toiletries, uh, I recommend one place for you. Travel General Trading. Travel General Trading are located right after the Jemima Hospital on Kufuor Street, right on the right side of the traffic light. Check them out or call 0549885272 for all your foreign home goods, qualification work, and your toiletries. If you want to stay fit, build muscle, improve on your cardio, lose weight, and move out of this stroke probability zone, I recommend RegiFit for you. RegiFit is here in the Western region. You can call this wonderful brother doing great job here. in the field of exercising on 0541084 or 02611 hey, if you need massage therapy services here in the Western region, Ghana at large, call Boom Rehab Massage Therapy and Clinic, and we are surely going to help you massage your stress away. Call Boom Rehab Massage Clinic on 0277 677 814. And if you're in Takrady, any part of Ghana, any part of the world, and you need quality made in Ghanaian shoes, I recommend this wonderful brother, Kingsman Shoes, here in the Western region. Call Kingsman Shoes on 0247403980. I say that again, 0247403980. I also recommend Dural Shifa Hijama Cupping Clinic for you, Dr. Salsa, wherever you are tonight. I say salute to you, madam, for the great work you are doing with your cupping therapy. Reach Dr. Salsa on 0244316779, 0244316779. She's right at the Ikea Quanta Prima Mall around Fijai. Check it out. If you need hand sanitizers, afterwash, alata seminar, wedding hats, general program deco, Elino Products is there to cater for all your needs. Call Elino Products on 02088998818. Over to you, beautiful Ella, our physiotherapist tonight. We talk to us about hemorrhagic smoke, ischemic stroke, and the TIA. We talked about the risk factors being hypertension, diabetes, smoking. We've ruled out all the myths associated with stroke. She's made mention of the indicators, talking about the FAST being the acronym for the facial drooping indication, the arm weakness, the slurring of speech, and the time consciousness needed to uh, take a person going through all these problems having stroke. Madam, over to you. Where do we stand as a country when it comes to stroke treatment? Are we on the higher side? Are we on the lower side? Are we intermediate or we are below average? Where are we?
It
How would
depends
you
on where,
rate us?
it
It
depends,
depends on where you are.
depends on where you are in Ghana, and depends on what you can afford. So it depends. Sade pan. It
Okay.
depends.
So
Yes.
let's take Western region as a case study.
Mm-hmm.
Yes. Yes.
So Western region is big. We've
It's
got the
big.
West
Okay.
is big, but
Yes.
Sakradi, we are not doing bad.
Okay.
We're not doing bad. We're not doing bad. But I feel like these days the awareness is more there. Thanks to programs like this. People
Right.
like
Solid.
that try to help with these kind of things. The awareness is more there, so um, people come. I feel like people report to the hospitals more as compared to maybe some years back when if they say it's a stroke, they'll rather go straight to a prayer camp or so yeah. But it can be better. It can be better, definitely. It can be better. But we are not bad. I don't want to say
Yeah,
that
no.
things are, but it can be
Right. Right.
better,
Okay.
definitely.
Can someone experiencing stroke die out of this condition, and at
It's
what
a
stage
major
can
death. It's
stroke
a
is a major
major
cause of death?
cause. I think it's the second leading cause of death worldwide.
Yeah, that's not a joke.
It's a major cause of death, and it's a major cause of disability. Major.
Hmm.
Yes. It's a major cause of
But
death.
there is one thing that really beats my mind, right? Let's take this couple. They are married for years. The woman cooks the food for the man. they all grow, they are not smokers, they don't drink, they don't do all this high risk factor attribute that you just made mention. But suddenly one gets stroke.
Yes.
How does that really come about?
Yes. So we're talking about the risk factors, and then remember we said there were some risk factors you can't control.
Like
So
the
then
aging and all that.
this age, but we've got sex, or let me say gender, not
Gender.
sex, gender.
Okay. Okay.
Men are more likely to have stroke.
Wow. Men are more likely to have stroke. Wow,
Yeah.
that is a great revelation. So to you men out there, including myself, from the specialist, she's telling us we are more at risk of having cerebral vascular disease, stroke than women. Wow.
Mm, yeah.
And what
And
happens to you women?
no,
You
women too.
you guys could,
No, most
yeah,
women get stroke, but there's like an age range where in
range,
men
okay,
it's more common in men, and then we've got family history, like genetics. There's
okay,
family, like maybe in your family you tend to have your grandfather had a stroke, your great grandfather had a stroke, your dad had a stroke. You should know that definitely there's something in your lineage that puts you more at risk.
predisposes you, right,
Yes, exactly.
right.
So is
And
there
yeah,
the
so my,
the
my next question is, who is at risk of losing their life between man and woman when they
I
have
don't
stroke or the recovery rate? You don't
tell it,
know.
I don't know that one. Who die?
Yeah,
It's like these things, the statistics keep changing. They keep changing. Like initially we say that stroke was more common in the high income countries,
okay.
but now stroke is more common in the lower to middle income countries as compared to the high. So it just always keeps changing. The statistics keep changing.
So in a year, can you give us just a rough stat about how many people
But that
new, yes, no, like new intakes of stroke patients you might have seen or come for you for your service on the average?
almost every day there's a new case. almost,
Almost every day.
almost every day of work there's a new case. Or every day, not every day there's a new
Wow.
case. Mhm.
And it's a start more high with women, between women and men. What is the ratio like?
Mhm. Let's say out of the whole population, this generally there are more women than men. I
Coming
don't know.
with stroke.
Yes, there are more women than men
Okay,
coming.
in the general
Yes,
population, right?
yes, there are
Okay,
more women. So it's like you see more women coming than the men. And then
okay.
also, especially with the men, they don't like to report to the hospital. I don't know what is that is about, but it looks like women are more like.
Our macho attitude.
Exactly. I didn't say you said it.
It's our macho attitude.
So yeah, but
Right.
every single day there's a new case. Every single day.
Okay. So in our local language, they call something analysis. When people sit and they get this pins and tinglings of the feet, they sleep, and one arm gets it. Is there any correlation associated with stroke with this symptom?
Um yeah. So with the tingling and the pins and needles,
Yeah.
it can indicate a lot of things.
Okay.
Yes, usually, um, some people have something like diabetic neuropathy, as like they have diabetes. If the diabetes is progressing, you see that their sensation gets bad, and then again, diabetes too is linked to developing a stroke. Even circulation, if they have like blood circulation issues and all of that.
Okay.
So you don't just, if it's something that's happening to you, you don't just, sit on it. Then you have to report, and they would, your doctor would find or try to get to the root cause of that. But while, like, for example, while somebody is experiencing a stroke, like, there and then, they experience, paresthesia, like their sensation, they might lose some sensation in certain parts of their body.
Right. But then, to what extent does stroke affect the environment of the person, the people that they live in with? And as a physiotherapist, do you have any caregiving assistance for family that might have a person affected with stroke?
Okay, so the stroke will definitely affect the person and the carers, the immediate carers, whether you like it or not. It will affect the people around you, because you become a bit more dependent. Depends, it's a skill. Somebody might be able to do a few things for themselves, but they'll need help using the bathroom. They'll need help feeding, help, and then it can be as bad as they needing help with everything, being on,
Mm.
diaper change. It's, yes, it can be a burden. So usually, if a man and the man suffers a stroke, the woman can, no longer really engage in any work, because she has to be there for him 247. And I don't know, but when it's the woman that gets a stroke, usually they send her to her family, and then maybe the man gets another wife. But there are some men that are also very, supportive and all of that. But
Supportive.
mhm. So it affects the home setting. It brings a lot of disputes. So
Mm.
it's serious. It's very serious, because now, let's say the man, the breadwinner, can't walk. He can't do anything. Already the cash inflow is, truncated, and then they are putting in money, paying for this, paying for medication, paying for therapy, paying for that, going to see their herbalist, paying a
Some
whole.
pasta here and there. Right. Right. So stroke patients surely go through a lot. Uh, there is 1001, and our resource person has done a yeoman's job, really educating us very much into details about this problem of stroke. Madam Ella, as we go down to the end of the program, what can we do as a people? What can we do as a people to move away from this risk factor? Your word of advice.
Okay, so the modifiable risk factors, we have to eat well. And when we say eat well, all of us, we know what eat well is, but we just don't
Yeah.
have the discipline to do it. um Keep the grains more, less carbs, less animal fats, more roughage, more fruits, more vegetables. Your diet, whatever we have to eat as though we are medicating ourselves. Eat as medicine.
Mm.
Okay, it doesn't mean don't indulge in other things, but keep it to occasionally. Okay, not every day. Every day you eat pizza, KFC, Coke, this, that. No. Some people can't even eat without Coke by the side. And it's
Wow.
gross. Yes, you don't know this. It's dangerous. So eat well, exercise, exercise. You can never underestimate the importance of exercise. They say exercise is medicine. So at least you engage in some activity that's going to improve your cardiovascular fitness. Um, what else? But help me. This is you know all these
I was just
things.
enjoying the levels that you were really taking us through. So,
Yes.
as
If
you just said, yeah,
you have to
it's
please
not.
quit and limit your alcohol intake. Okay, if you want to have a beer every Sunday, a bottle of beer with your fufu and light soup, okay. But just
Hey.
the alcohol intake and smoking, I can't say limit smoking. All I have to say is quit smoking, and then um get regularly checked. Don't always be in the house, you know, at least, occasionally, once a year, the beginning of the year, just go, let them just do a general checkup. Check your liver, check your kidney, check your sugar. Or especially if you're after 50 years, you have to do these things regularly. It's not
Right.
the day you get a stroke, it's the day that the doctor will discover that you have been battling hypertension, but you don't know. That's the same day we'll discover that you have been battling diabetes, but you don't know. At least if you check regularly, any small thing, like this numbness and tingling and all of that.
Right, right. So from all that our research person is telling us, lifestyle, lifestyle, lifestyle. Be aware of yourself. Know how to take good care of yourself.
Thank you so much for such a show or a program that's
Yeah,
enlightening the
right,
general public. People will
right.
get
And thank you for also honoring our invitation. Yes,
the
I know
pleasure.
what they're telling you, but actually,
The
you
pleasure.
really made time for us. So quit smoking, reduce that alcohol intake. Better still, quit. Yeah, eat well. Let
Hmm.
the greens be more. Uh, be active. Exercise. Move that body. Don't sit all day. Exercise. Just with a skipping rope. Go out for walk. And late night eating, I guess. Late night eating. Too much late night eating. Shall I put a stop to it? Creating that pot belly. It's like you are how many months pregnant after a man? Yeah. So yes, let's live healthy, as our sister said, Charlie. Thank you so much, Ella, for having this much time with us to educate us about this. I've learned a lot from this, and even from standing and ejaculating side of things. It's a great revelation, and I sure know that someone to have heard the wheelbarrow for the first time and might be laughing at some corner. Don't go try that at home, Charlie. You will break your leg. So thank God for bringing us this far. Thank God for the education. Thank God. And at any point in time that you come across this stream, share it because Charlie, we all need to save ourselves. You might not hear this message anywhere on the radio or TV, but once we are all much more engaged on social media, when you see the topic, share it for the next person who might have been busy around this time to also listen to it and take some speech from it. So Ella, salute to you, and as you leave us, if you have any last words, some shout outs to your loved ones, over to you before I wrap up.
Thank you, Caliber, for having me.
Yes, madam.
Yes, my shout out goes to you.
All right, so bye bye. Hey,
Bye.
thank you. All right. So on the flip side, that's our sister Lisa, we keep moving with the program. As I said, if you are in Takrady and you want any foreign home quality goods, kitchenware, toiletries, I recommend Pravi General Trading for you. I call Pravi General Trading on 054988852272. Once again, 0549885272. If you want massage therapy services, call Bone Rehab Massage Clinic 0277-677-814 for all your mobile services, massage therapy services. Bone will be there to help. massage your stress away. Kingsman Shoes is right here in the Western region. Check them out for your quality made in Ghana shoes. Check Regifit for your fitness goals. I also recommend Asu Black Soap made with name for you, Elias, to pick up yourself wherever you are. To everybody who had a time to watch and at any point in time when you have time to watch this stream, I'm entreating you to share it so that others will also join into this conversation, join into this educational platform. So together we all learn together and grow healthy. Once again, my name is Lord Caliber, and thank you for being my guest. I say respect to you and to all the monitoring team. Madam Leonora, Anissa, Empress One, big up yourself. Lugia, big up yourself. Imai, Kenneth. Hey, to all the family members, I say salute to you. And to meet next week as we'll be discussing another complicated and dicey topic on prostate. Prostate is also causing a lot of problems with men's health. So next week, God willing, strength and health, we would have a doctor who would also be educating us through the subject topic on prostate and all the related problems affiliated to it. I salute you wherever you are on this planet and I say, choose God first. Fear God, love God, keep His commandments, be good to yourself, live healthy, and be nice to the next person around you. Life is short. Live your life well. One love.